Oftentimes, some of the sleep issues just have to do with poor structure around, just kind of sleeping habits. So, developing a good sleep hygiene is probably the best place to start. And that means, trying to kind of have dinner at the same time, maybe have a similar routine that kind of preps the child and the body to want to go to sleep. Turning off those screens and those devices, probably a good half hour to an hour before going to sleep will also be helpful. Just having kind of that sleep hygiene and the structure and the routine and maintaining that routine or trying to set up a routine, because oftentimes there isn't much of a routine at night and things get a little crazy. And, oftentimes parents are like, well, maybe if I give them a nice warm bath right before going to bed, and that will help them, go to sleep. And sometimes that's the opposite of what the child needs, right? So figuring out also what is calming for each child, it might actually be jumping, and doing jumping jacks before going to sleep instead of the nice soothing bath that we might think for ourselves is soothing, but not necessarily calming for that child's system. So trying to figure out what is calming for that child and then setting up a sleep hygiene that includes the structure. And if that doesn't work, then potentially moving on to explore other options that might include melatonin use or some sort of medication if that were warranted. But I think first is setting up these structure and sleep hygiene to kind of set the tone and set the mood for that child. And certainly figuring out what's most calming for that child, which may not be what's calming for me.